Hello, my name is Angel Lopez, and I am applying for the Evergreen Valley College nursing program. So I want to be a registered nurse just because I love to help others. From a young boy at 8 years old, my brother was diagnosed with brain cancer. At the same time, one of my school friends was diagnosed with leukemia. So I had my brother and a close friend both at the UCLA Mayfield Children's Hospital and ICU, a couple doors from each other. Through this experience, I was able to see just what it is to be a nurse and a doctor. Not only cared for my friend and my sibling, but also cared for the families and us in general. This is when I realized that I wanted to help others and impact those in need and their families. Um, from a young boy, I saw the stress on my parents' faces, and also I saw the fading away of my friend and passing on, the recovery of my brother and the struggle. And every step of the way, those nurses were there. And it wasn't easy, but they did an excellent job. It was really inspiring and motivated me to seek a career in the medical field. Um, so I later ended working as a nursing assistant, and I want to elevate myself further to the next step to put myself into a hospital setting where I can further use my compassion, critical thinking, and become a fountain of knowledge for myself, peers, and patients. Um, so as for the first point, my education and background experience, I worked as a certified nursing assistant for a home health care company. I did the hospice care there for 5 years. So during this time, I was able to exhibit compassionate care, develop communication regarding issues surrounding death and dying, reassuring family members with proper care of their loved ones, learn to lift patients safely and properly for showers and their general hygiene. I was also able to maintain accurate and timely flow of information on their charts by completing, their patient records and updating that to the healthcare teams. And overall, I'll be able to be on the same time frame. So I later went on to work as a certified nursing assistant at an assisted living home, Valley Pines, for 2 years. So I conducted routine checks on standard patients' vitals, including blood pressure, blood sugar, and heart rate. Ensured cleanliness of their environment, providing a safe and comfortable place for rest, and just overall ensuring better wellness for the patient. During my time working as a hospice and school, I was also working at T-Mobile. Um, through my genuine care for people, my excellent customer service skills, I was able to sling forward with my sales into leadership and become a manager at T-Mobile. So I studied various leadership training programs at corporate and learned to effectively communicate and lead better. I was able to diffuse upset customers and present solutions to ensure just the overall greater customer experience. The second reason I have is also the skills that I have acquired as a nursing assistant. So I've learned better stress management through the experience of just the critical situations that happen in my nursing assistant jobs. I've gained a more calm and clear way of thinking on my feet to more effectively problem solve. I'm able to understand what the stress is doing to my body and how much my adrenaline can spike all of a sudden, right? What are those factors that might have somebody just sit there and stand in shock? By understanding what my body is going through, I can use that fight or flight response to quickly and calmly handle urgent situations. Having worked night shifts and long shifts, I can also understand that being rested and having a strict bedtime will help you deal with stress and perform clear, more concise thinking throughout your day. During those more stressful times, you're able to react better. It's also very important that you do things to de-escalate your stress, not just at work, during work and off of work. One of those things for me is spending time with my family, my son, going to the park and playing soccer. I love just being out there in the sun, hanging out with him, going out to the beach, my family. It's just really rewarding. Also, another reason is, or another thing that can help de-escalate stress is to just pause and take a breath. Sometimes a quick pause to gather my thoughts and process what just happened, do some post-processing after a traumatic event. or a situation like that. Just doing some breathing can quickly just calm my mind. It's important to process the thing that just happened, and follow the steps through and give yourself some time to talk with somebody else. Which leads me to my next point, is just asking questions, right? What's one of my biggest strengths is not to be afraid to ask, and then also listen. This helped me vastly gain better knowledge and support during stressful times, to get somebody to help me out, to find the answer to something that I don't know. It just overall makes for a better handling of stress the next time when you have the right answers. Um, Another skill that I have learned is time management. I have worked night shifts and long shifts. I followed a strict bedtime again, wake up routine in order to ensure an adequate night's rest. I've commuted to the Bay Area for about 8 years. I now live in San Jose, but I still always plan ahead for delays and arrive early to work. I ensure to give myself a schedule for my week for my studies, uh, study, work, play, and rest. Just ensuring good time balance for everything. Um, and then also just managing schedules for employees. I've gained a deeper understanding of just time management for others and ultimately for myself. The third reason that I have is I have recommendation from a previous employee who I asked permission to share what they said for me when I was their manager. And this is what he said. I had the pleasure to work with Angel Lopez at T-Mobile. During my time there, he helped develop me and coach me into becoming not just a sales consultant, but he also helped me become a better leader. I owe a lot of the leaderships I have learned from him. He brings out all the best out of the sales consultants and is very passionate about his work. I would recommend Angel Lopez in every company. The fourth reason, and I think the biggest reason for me, is I am very empathetic and communicative person, and I go the extra mile for people. I can quickly build rapport with people, just building an intimate experience, asking open-ended questions. Oh, you have a son? Do you have any kids? Or what's your favorite basketball team? Just getting those little points right there can make that experience much more intimately. And that's helped me out a lot with my sales, with my people social building skills, and then also with my care for patients, get their mind off of something and get my mind off of something. We can both have a good conversation, and I love to do that. So through my years of experience, I've also learned that empathy only becomes stronger with my skills to care for patients. Also have learned that it's not only the patient you're caring for, but it's everybody in that room as well, their family members, their loved ones. So being empathetic and educated puts the patient at ease, and with that education, you can better provide better care and reassurance to the family. I generally strive to give the best care for my patients, and I have had a lot of experience with death and dying, and I've never become any less empathetic personally or numb, which leads me just to say that I generally feel for others. And in the beginning, that was a weakness for me. I didn't know how to quite handle death and dying. It was a new experience, very fresh. I now have a good process of, during those times that it can be hurtful, is giving myself a short break, post-processing, talking about it with others at work who I'm able to. And then I look forward to the next person I can help and carry forth that knowledge and care, and just understand that it's just a part of what I do, and part of what I do with that loss and death and dying. There's a lot more life that comes out of there, and I'm doing a lot more. Overall, in conclusion, upon being accepted to the EVC nursing program, I plan to become a sponge and gather more valuable clinical experience. Through the professors and professionals, I can become more effective in my career by learning from their wisdom. I hope to discover a specialization treatment in my clinical experience. With great compassion and open-mindedness, I come to the program ready to learn and grow. Uh, I have a big hunger for helping others, and that fuels my focus and also feeds my heart great satisfaction, because it's something that I really love and enjoy to do. And I don't feel like I'm working. I'm doing something for others, and I just enjoy it. So I'm looking forward to graduating from this program and looking forward towards the future in nursing. Thank you.